Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. This is a webinar where we talk about Lyme disease and things related to helping your health. So these webinars are created with your questions. So I'm interested to see what you have in store for me tonight. I see a number of familiar names that are showing up on my message board, but I also see a lot of new names as well, too. So to those of you that are new here, welcome. For those of you that are returning, I'm glad to see you keep getting value from these too. So the way you participate is you can listen to the answers I have to questions, or you can try to write your questions. And the way where you write your questions is over on the right-hand side of the screen, on the bottom of the screen, you'll see a chat box that you can write your question to me. The thing I ask about those questions is try to be brief with them. If they get too long, I can't post them. They get too hard to follow for everyone, all right? And as you're writing them, please only hit the enter key when you complete the whole question, because otherwise it sends multiple questions my direction. It breaks them into pieces, and then I can't follow them from my side of the screen here, all right? I am creating a recording of tonight's webinar, and tomorrow morning you'll get an email from me announcing that it is done. I plan to have that done before I start seeing patients here in the clinic in Seattle at 8:30 a.m. So it'll be early in the morning that I get that to you, okay? If everything goes as planned, that is, I'll be sending it out. Sometimes the recording doesn't get saved to YouTube as it's supposed to. So we'll see how that goes. I plan on doing the edits on it tonight, if that all works out fine. So this is the last webinar for this month. I won't be doing one next week. I usually do 3 in a row and I take a week off. So next week I'm going to be taking the week off. But in the email tomorrow morning, I will have a sign up so you can sign up for the October series of webinars, because there will be an October series, okay? During the webinar tonight, you will see, for those of you that are participating in the live version, I will actually post the questions on your screen so you could read them. But I am still going to read them because so many people follow this in the recorded version and watch it on YouTube where I save it. Okay, all right. So anyhow, just you'll see that I'm going to read the questions out loud. So I think I've said enough stuff here. Why don't we go ahead and get started? We'll take our first question here tonight. All right. Hello, Rose. Let's see. Hi, Dr. Ross. Thanks for taking the time to share your wealth of knowledge with each of us. You're welcome. Let's see. It really means so much. Good, good. Let's see. I have 3 questions, please. 1, I plan to start taking ATP 360, liposomal glutathione, and N-acetylcysteine. Just wondered, when is the best time to take each one, without food, and time apart from antibiotics? I know that the NAC should be taken 2 hours apart from antibiotics, and I'm taking 600 milligrams of rifampicin first thing in the morning. All right. So first of all, I really don't care. I usually don't do restrictions food-wise. In other words, I don't care if people take these with or without different medicines and supplements. I find they work either way, to be quite honest. The rifampin that you're talking about, though, however, does need to be taken on an empty stomach. That's just the nature of rifampin. It does best if you take it on an empty stomach, okay? Number 2, is it best to take the supplements apart from antibiotics? And again, other than rifampin, I don't find any difference in how these work or the antibiotics work when you take them with or without antibiotics, or with or without other supplements at the same time. Number 3, I have read that R-lipoic acid is more potent than alpha lipoic acid and more easily absorbed. So just wondered how you would compare 300 milligrams of alpha lipoic acid versus 75 milligrams of R-lipoic acid. So to be honest, I don't usually prescribe the R-lipoic. I only use alpha lipoic. So I'm not familiar with the dosing comparison or how to recommend that in terms of the differences, okay? All right. Sorry about that, Rose. Sometimes I do get stumped here, so there you go. Right. Thanks for that question. Good luck to you. Hello, Luke. Let's see. Hello, and thank you for your time and webinar. You're welcome. I tested positive for Lyme, Bartonella, chlamydia pneumonia, and chlamydia trachomatis ever since this started in 2018. I'm experiencing libido loss and sexual dysfunction, and I am 22 years old. This started with the illness. Is this something that happens, or can this be reversed? Do you maybe have some experience with this problem? Thank you, and sorry if the question is disturbing. No, it's not a disturbing question. That's a relevant question. So many people with Lyme, men and women actually, will have loss of libido as part of Lyme. And there's multiple reasons that can occur. Okay, number one, just from feeling like crap from having the illness, it's hard to be interested in doing sexual activities. Okay, so just from feeling poorly, you may lose interest. Number two, you can have loss of sexual drive due to low thyroid or low adrenals. And so one thing I always try to do with my treatments is I like to do screening questions to see if somebody might have low thyroid or low adrenals. I'll show you where you can look at those here in a minute, okay? If you do, then you should correct for those, all right? The third thing that can happen is because of Lyme triggers the immune system to manufacture too many inflammatory chemicals called cytokines. And if you read my things at my Treat Lyme site, or you listen to these webinars, you know I talk about cytokines a lot. So cytokines are good and bad. The cytokines are made by white blood cells when they see an infection or they see a mold toxin in you, and they are meant to turn on white blood cells to fight infections. And they help create more white blood cells and draw them to where the infection is, okay? So that's all good. But if the immune system is having a hard time getting rid of toxins or having a hard time treating infections, it works harder and harder and eventually makes too many cytokines. Too many cytokines make it so you can't think. They give you pain. They give you fatigue. But the other thing they do is they interfere with the correct functioning of the part of your brain called the hypothalamus and pituitary, which is supposed to govern all of your hormonal systems, including the adrenals, the thyroid, and females, their ovaries, so estrogen, progesterone, and testosterone production. And in men, the testicles, which is testosterone. Okay, so yes, females make a little bit of testosterone in your ovaries as well, too. All right. So the other thing that you could have looked with this, in addition to lowering cytokines by being on curcumin. That's what I like to lower cytokines. It's a 500 milligram pill 3 times a day. And to correcting adrenals and thyroid, and a simple way to do that is to be on herbal supplement called ashwagandha. Ashwagandha supports adrenal and thyroid function. And that ashwagandha is 400 milligrams, 2 pills in the morning and 2 pills between 1 and 2. So in addition to doing curcumin, in addition to doing ashwagandha, which may lower cytokines, the other thing that you might want to do is ask if your physicians would test you for your testosterone levels, okay? Or in a female, if this is happening with you, you might want to have estrogen, progesterone, and testosterone tested, all right? All right. So those are some things to look at, all right? Okay. Good luck to you, Luke. Thank you for that question. Hello, Lisa. Hi, Doc. Once one reaches remission, do all the familiar Lyme and co-infection symptoms just stop all at once so that the person is symptom-free, or is it gradual improvement? If it is gradual, how can you tell it's not the waxing and waning of Lyme? Also, if taking a probiotic to help the gut after many years of harsh antibiotics, is Sacro B also recommended? All right. So if you've been on antibiotics and you've been on antimicrobials, even anti-yeast medicines, at the end of treatment, it's useful to rebuild the healthy bacteria and the healthy fungus that make up the intestines, all right? So you can use regular probiotics. You could use the common probiotics that are out there usually have human strains of bacteria in them. So they usually would have strains of lactobacillus, and they would have strains of bifidobacterium in them. And any of those could be useful. I like using a product called HMF Forte for that. But I usually do anywhere from 2 to 4 pills 1 time a day. In addition, it's useful to put back in a healthy fungus, a healthy yeast that is, which is called Saccharomyces boulardii, also known as Sacro B. Thorne makes a product for that, and it's 2 pills 1 time a day. So usually I'll try to replace both, okay? Regarding remission, so remission may mean that you don't get 100% well. And part of the problem is with Lyme is that sometimes the injuries that get created by the infection can be permanent, okay? When one does go into remission, it could be that you suddenly have a lifting of everything, or it can sometimes be a gradual lifting of symptoms. So I'm sorry, I don't have a good answer for you on this one, okay? Nor do we have a test to tell you if you're in remission. We just have to kind of got to look at what are your symptoms doing? Have you hit a plateau? Have we done extensive treatments of things that might get you well? And then kind of look at all that and figure out clinically, do I think you're in remission or not? Okay. All right. Thanks for that question, Lisa. Good luck to you. Hello, Wendy. Let's see. Thank you, Dr. Ross, for sharing your knowledge. You're welcome. Let's see. I've been dealing with Lyme and reactivated Epstein-Barr since last fall. My major symptom is internal tremors and vibrations. I do take 100 milligrams of gabapentin 2 times a day. Can you suggest anything else that can heal my nerves? So just a few things. So it is interesting that feeling of vibrating and buzzing is something that I tend to see more as a Bartonella symptom. All right. Now, so it is possible it could be part of the Lyme germ, but I also see it as part of Bartonella. So one thing, Wendy, that I would take a look at is to make sure you don't have anything else suggesting Bartonella. And so, or that you have any testing suggesting Bartonella, right? So Bartonella symptoms can be pain on the soles of the feet, can be joint pains, can be air hunger. That can be a Bartonella symptom, which it can also be a Babesia symptom, air hunger, but Bartonella can have air hunger as part of it too. Bartonella tends to give a lot of neuropsychiatric symptoms. So on the psychiatric side, that could be hallucinations. It could be neurologic hypersensitivities like sound, light sensitivity. It can be anxiety. It can be depression. It can be tremors. It can be buzzing. It can be seizure-like activity. And Bartonella also can give you sometimes loss of feeling or nerve pain. Nerve pain would have qualities of sharp stabbing, shooting, burning, piercing, or electrical kind of pains, okay? Bartonella also can sometimes give people rashes that look like stretch marks or scratch marks that run perpendicular to what we call the skin lines, okay, the natural way the skin folds. So for instance, if you're trying to figure out what a skin line is, you can do the squeeze test, all right? So if I squeeze my skin this way, it bends really easily that way. So the skin lines here in the hand run this way. They fold that way really easily. But if I squeeze them this way, you see they don't form the skin lines as easily, okay? So if they form this way really easily, that's where your skin lines run. But anyhow, Bartonella rashes tend to run perpendicular up at a 90-degree angle to the normal skin lines, okay? If they do that, that can be a sign that you have a Bartonella rash, okay? So first of all, figure out if you have Bartonella, all right? I'll show you an article I have where you can take a look at how to do that here in a second, all right? Secondly, you want to calm down that agitation of those nerves. And one of the things that can be helpful is gabapentin. I would use a higher dose than what you're using. I tend to find better benefit taking 300 milligrams, even up to 600 milligrams at bedtime, actually. You just need to do it 1 time a day. So you might want to look at that as well, too. Other things that can heal the injured nerves are glutathione. You like using liposomal glutathione. The product I like for that is a product by Research Nutritionals called Trifortify. The reason I like liposomal is it's glutathione that's microscopically wrapped in fat so that it gets better absorbed, okay? Glutathione is the master antioxidant that is found in every one of our cells, and our cells make it to repair damage. But if your nerves are injured, they sometimes exhaust the glutathione gas tank, so you need to put more glutathione in. Okay. You can also think of glutathione as being the master detox chemical that is made to help the liver detox substances out. And finally, glutathione is also really useful for lowering cytokines. It's a very powerful antioxidant that tells the immune system or lowers oxidizing agents that tell the immune system to make cytokines. All right. So you can use it for that purposes as well, too. All right. So first of all, I would treat Bartonella probably, or make sure you don't have Bartonella. Number 2, increase that gabapentin even up to 600 milligrams at night. Number 3, get on liposomal glutathione, 5 milliliters one time a day, or if you're doing capsules, 400 to 500 milligrams one time a day. And the last thing that can sometimes help is to repair the nerve covering and also the covering of the energy factories in the nerves. They're called mitochondria. And to do that, I like using either ATP 360, which is made up of the fats that make up your nerve cell membranes and makes up your mitochondrial membranes. And that's 3 pills one time a day. If you happen to be taking something for which you cannot take coenzyme Q10, which is in the ATP 360 in addition to the fats in it, if you can't be on the coenzyme Q10, which you should not be on if you're on atovaquone, Mepron, or Malarone, if you cannot take CoQ10, then you want to use NT factor instead of the ATP 360, and you would do that as 2 pills 3 times a day. Okay, all right. So let me just do a quick screen share here. I want to show you some things. All right, so this is my Lyme disease guide. This gives you information about just about anything you'd want to know about managing Lyme disease. Most recently, I put this new tab up here, which is what do you do for an acute tick bite? I get asked a lot of questions. You may have family and friends that approach you because they know you have Lyme disease and you should know what to do for an acute tick bite. Send them here. I talk through the science and what you should do about an acute tick bite, okay? Here is my full treatment protocol, but over here, this is my online guide for managing basically any problem you might have in Lyme disease, okay? All right, so in terms of how do you diagnose Bartonella, take a look at my section here called How to Diagnose. And here's my article on how do you diagnose Bartonella, where I talk about the symptoms that you want to consider, okay? I even talk about testing in this article as well, too. Okay. All right. The other thing in terms of what do you do to help repair your injured nerves, which is what I was just telling you about, take a look at my section called Brain and Nerves here. And you could read either one of these articles, which basically tell you to use glutathione and to do repair of the mitochondria and nerve cell membranes using the ATP 360 or the NT factor. Either one of these is an article that you can read. Okay. All right. Oh, and then finally, if you're looking at what do you want to do for Bartonella, how do you treat it? Take a look at my article called Kills Bartonella, a Brief Guide. Okay. All right. All right. Wendy, thanks for that question. Good luck to you. Let's see here. There we go. Hi, Megan. Let's see. Hi, Dr. Ross. If someone takes amphotericin B orally for 2 months and yeast does not resolve, what do you do then? Also, if you need to do a repeated round of amphotericin B in the future, if yeast were to return, is there resistance? Thanks. All right, I'll be glad to answer that. Hold on here just a minute. All right, so when it comes to treating yeast, there are a variety of things you can do. And I usually reserve amphotericin B as something you could take if everything else fails. Okay, so it tends to be the thing I do when things fail. All right, so it's a good question you're asking here because it does happen every now and then even amphotericin B fails. All right, so first of all, when I treat for yeast, if somebody has too many yeast in the intestines, usually the first thing I'm going to try is to treat them with a combination of nystatin and a nystatin that is, and a prescription medicine called diflucan, also known as fluconazole. That combination will work about 90% of the time and takes about a month. There are some people that develop resistance to that, okay? If somebody that does not work, then my next approach often is going to be use that nystatin, 2 pills twice a day, along with a a family member of the diflucan, which is called itraconazole, also known as Sporanex. And I find that that will work about 80% of the time, even if the diflucan nystatin failed, okay? All right, now, if that fails, then I'm going to start looking a few different directions. One is we could go herbal. And we could go herbal by using a combination herbal product, usually made up of some, it will have caprylic acid, powder co, some rosemary oil, thyme oil, and something called undolenic acid, 2 pills twice a day. That works about 80% of the time. It takes 2 to 3 months, okay? Or you could try something called terbinafine along with nystatin. Terbinafine is Lamisil, which is made for athlete's foot, but sometimes can be useful for yeast, and that works about 80% of the time. But my go-to, if everything else fails, is amphotericin. Now, amphotericin, for those of you that are not familiar with it, is a medication that is made for intravenous administration only. But in the world of yeast overgrowth in the intestines, we want to use it in a pill form. So we have to have it made by a compounding pharmacist. And the reason it's only manufactured in an IV form is that it doesn't get absorbed in the intestines. It stays right there, okay? And so therefore, it doesn't have, if you take it in a pill form, it's going to stay where we want to use it to treat yeast. All right, now, amphotericin B, 200 milligrams 3 times a day, in my experience, will work about 95% of the time when somebody has too many yeast in the intestines, but it will take about 2 months. And you can use it by itself and with probiotics, okay? So now, what happens if I try it on and they don't get better? They still have gassiness and bloating, and they still have other symptoms suggesting yeast, okay? At that point, these days, what I'm starting to do before I go further is I want to reconfirm that it truly is yeast, okay? Now, many of you may be familiar. Over time, I usually say there isn't a good test for too many yeast. However, when I get into these situations, I sometimes will actually try to do some testing to see, can I prove yeast really is there? Okay, it's not the greatest test, but if it comes back positive, it does mean yeast is there. And that is to do a test called an organic acid test. And in the organic acid test, which is a urine test, you pee and you send it to the lab. And one of the organic acids that is looked at is something called arabinose. If you are making large amounts of arabinose, that can be a sign that you have too many yeast in the intestines, okay? All right. I don't rely on yeast cultures because we all have yeast that live in our intestines. So if you grow yeast, it doesn't tell me it's too much. I don't rely on yeast antibodies. And the reason is that we all have yeast living in our intestines. So we probably all make antibodies against yeast. But if push comes to shove and I really want to see if yeast is still there, I will measure this organic acid test, it's a urine test, and look at the arabinose level, okay? Who does that is a lab out of Kansas called Great Plains Lab. It's a urine test, and I find that helpful, okay? The other thing I'm going to do, if somebody's not getting better, they still have a lot of gassiness and bloating, it's then that I want to exclude that they might actually have another problem instead of yeast, which is called small intestine bacteria overgrowth, also known as Sibo. And in Sibo, what happens is you get a bunch of bacteria that are supposed to be living in the large intestines that work their way up into the small intestines. And if you have too many yeast there, they can ferment the different sugars, creating gas that makes you gassy and bloated, okay? And so the testing for that is to do a breath test where you drink a sugar called lactulose, and then over 2 hours, you breathe into test tubes that is sent to you by the lab, and then we see if you produce too much of methane or hydrogen, all right? So in situations like you're in, where I've given yeast treatment with amphotericin and they fail it, I'm going to reconfirm I'm treating the right thing. All right. And so to do that, I'm going to do the arabinose as an organic acid test, and I'm going to get the Sibo breath test. And the lab I like using for that is Genova Diagnostics in North Carolina has a test kit that you can use to get that done. Okay. All right. Right now, let's say that test comes back saying it's not Sibo and that it still is yeast. All right. then we're kind of in a pickle because the amphotericin didn't work, okay? So sometimes in that situation, if somebody has not tried herbal methods, I may go back and retry the herbal methods, all right? Okay. Now, there is another way that you could do it is to try a product called Deufeneron. Now, Lufenuron, I want to let you know, is not approved by the FDA, all right? And so it has not been proved because no one's done safety studies on humans long-term to see if it's safe, all right? It's actually an agent that is included within insecticides, all right? So I say this carefully, all right? But what it does is it's a chitin inhibitor. It prohibits yeast from making oh, I'm sorry, everyone. I'm trying to make it so that this person stops calling me here. Anyhow, Lufenuron is a chitin inhibitor, and yeast make a hard covering made up of something called chitin. Insects that have hard shells on them or crusty cells on them, that's made up of chitin, all right? We as humans don't have chitin in us. So in theory, a chitin inhibitor is not going to hurt us in any way. I will tell you, though, we have no human safety studies, but you can still get this, and it's very fat soluble. So if it goes in you, it's going to stay in you for a while. I do have an article about it, and so I'd refer you to the article. I'll show you where that is here in a minute. If it is one of those last resorts that I use. If everything else fails, I might try Lufenuron, but I want to be clear, it is not FDA approved. This is something I advise patients that I think it is safe to use. I've only ever had one person have an adverse reaction to it, and that is they had an allergic reaction. And the trouble is because it's so fat soluble, things that are fat soluble can take a good 2 weeks to a month sometimes to get out of us, okay? So if you have an allergic reaction, it can be difficult, all right? So I've said a lot of stuff here. Let me do a quick screen share for you, okay? All right, so first of all, if you are new to treating yeast or to diagnosing yeast, take a look at my chapter here called Yeast, all right? And in here, I talk about how do you diagnose yeast. I will let you know I do need to do an update on this to include information about the arabinose test. This is a newer way I'm looking at trying to diagnose yeast if I can't tell it's there. But you can follow all the clinical guidelines I have here. But if you start getting into a question about whether it's still there, then I'm starting to rely more on this arabinose organic acid test, okay? All right, if you want to know how to treat yeast, take a look at this article where I review all the options. And if you want to know more about Lufenuron, take a look at this article called Lufenuron and Experimental Yeast Treatment, okay? All right. All right. Good luck to you, Megan. Thanks for that question. Oh, your last part. I have found if somebody does have resistance to amphotericin, that if yeast returns in the future, sometimes it will work again for that person, though. Okay. All right. Okay. So in terms of Sibo, I'll just show you a quick way to find it. It's one of my newest articles. So if you take a look in my latest article section here, here is the recent article I wrote about Sibo, okay? And in here, I talk about how to diagnose it, and I also talk about how to treat it, okay? All right. All right, everyone. Thanks for giving the questions back. Again, it was a technical glitch, so I just literally lost everything. All right, let's see here. Fiona. Hello, Fiona. Let's see. Thank you, Dr. Ross, for all you do. I'm in Toronto, and while the number of COVID cases are increasing in the second wave, 27.4 average per million, our numbers are comparable to those of the US states which have the lowest, between New York and New Hampshire. As a senior in remission from Lyme and isolating as much as possible, curbside pickup only, very small bubble, I'm struggling to make the decision whether to get the flu vaccine this year. What are your thoughts? What advice do you give your patients once they reach remission in order to maintain it? Okay, so the flu vaccine and this year creates some obstacles, all right? So first of all, in general, when somebody has active Lyme, I usually do not recommend they get the flu vaccine in most seasons. I'm going to come to this season in a minute, okay? The reason I generally do not recommend that people get the flu vaccine is in Lyme disease, when people have active Lyme, we tend to see that Lyme can get a lot worse when they have the flu vaccine, okay? Now, I do make an exception in regular years without COVID-19 for that. So first of all, if I've got people with diabetes or asthma or chronic heart disease, and they're over 65 years of age, I do think there's enough risk and harm from getting the flu that it does warrant getting the flu vaccine, even if it means there isn't a problem that you may happen to get worsened Lyme at that time. Okay. It's a matter of weighing risk and benefits. Okay. So although we know the flu vaccine, when you have active Lyme, can sometimes make Lyme worse, you have to weigh it against the risk of getting harm from the flu. And if you are 65 years of age and older and you have heart disease or diabetes, there is a lot of risk in getting the flu. And I do think, therefore, the flu vaccine is warranted. Okay. Now, what about this situation where you are a person that is in Lyme remission and you are over 65 years of age, I believe? You're a senior, you said, so I'm going to assume you're over 65 years of age, okay? All right, and we have COVID-19, all right? So in this kind of a situation this year, okay, I may make a different recommendation next year. This year, I'm actually recommending people get the flu vaccine, especially if they are asymptomatic, because the chances are of you having harm from getting the flu vaccine is actually smaller than if you have active Lyme. Okay, number one. But this year, the reason I'm recommending it is it would be really tough if you got the double whammy of getting the flu and COVID at the same time, which could happen. All right. And so for that purpose, I am recommending it. All right. Now, am I right or wrong? Who knows? We have no science to guide us here, but my thought would be it is worth to go ahead and do it. Okay. All right. Good luck to you. Thanks, Fiona. And that even means in a situation where you have lower rates right now, because who knows if you might start having community spread and just not be aware of it until it starts getting high rates. Okay. All right. Good luck to you. Hello, Gail. Let's see. Hi, Dr. Ross. My chlamydia pneumonia IgM is off and on elevated. My Galaxy Labs Bartonella cantana is 1 to 64, Bartonella henselae 1 to 128. My IGeneX Lyme IFA is over 80, and I have 2 or more starred bands on the Lyme Immunoblot IgG. I just had the Infectalab America done, and it showed that Lyme spot is positive, Lyme OSP was negative, and Lyme OSP IL-2 was borderline. The chlamydia pneumoniae spot was very, very positive, as was the chlamydia pneumoniae positive, and Bartonella spot was borderline. 2 questions. What is an herbal protocol for chlamydia pneumoniae? You give tests like Infectalab a B-. How much credence should I put in the results in regards to what to treat first? All of my symptoms could be from any 3 of these infections. Okay. So Gail, this gets tricky. These are the kind of situations where I want to talk to you so I can get a better sense of what your symptoms are and where to go first. Okay. But I'm going to make a general comment. Number 1, I don't believe chlamydia pneumoniae is something that the average person needs to treat. All right. Now that may sound heretical, but let me explain why. So if we look at healthy people, these are people that have no symptoms at all. We take 100 of them and we test them. All right. These are healthy people, and if we take 100 of them and test them, I might find results like you have for chlamydia pneumoniae. All right. In fact, we can see evidence of chlamydia pneumoniae, mycoplasma pneumoniae, Epstein-Barr, a cytomegalovirus, or human herpes virus type 6, elevated immune response against any one or all of those showing up in 10 to 20% of healthy people. All right. So just having evidence, immune reaction evidence against these germs does not mean they're causing you problems. These are common germs that live in healthy people that do not give problems. All right. So I generally don't treat for chlamydia pneumoniae. I don't think it gives problems. I think the bigger chances of problems are Lyme and Bartonella. All right. All right. And in terms of Lyme and Bartonella, you've got some laboratory evidence of Lyme and Bartonella. That is where I would focus my efforts, and I would not treat chlamydia pneumonia. And generally, I don't. Now, having said that, when you use any herbal or prescription antibiotic that treats intracellular Lyme, chances are it's also treating chlamydia pneumoniae at the same time. It's the same antibiotics, okay? All right. Thanks for that question, and good luck to you. Hello, Lindsay. Let's see. If I'm suffering from POTS symptoms, oh, hold on here a minute, everyone. I've got to take care of something here. All right, I just changed this so the chat is clear that this is a private messages that I want to have people send. All right. All right, so let's go on here. Let's see. Send to admin only. If I'm suffering from POTS symptoms, will treating Babesia alone with the symptoms, or do I have to be treating Lyme at the same time? Been having a hard time with leaky gut and long-term use of herbal antibiotics. Thanks. So POTS, everyone, stands for postural orthostatic tachycardic syndrome, okay? Which means that you have periods where your heart races and periods where you just randomly drop your blood pressure, all right? All right, and what that is due to is part of something called dysautonomia, which means that the part of your nervous system that releases adrenaline and anti-adrenaline is not correctly regulated. So it will randomly release too much adrenaline that can make your heart race, and periodically release too much anti-adrenaline that causes your blood pressure to drop, okay? All right. The nerve that is involved in regulating the autonomic nervous system and adrenaline, anti-adrenaline is a nerve called the cranial nerve, or cranial nerve number 10, all right? It's called the vagal nerve, all right? And the vagal nerve can sometimes get infected by Lyme, and it can sometimes have problems when you have Babesia too. So when I've got someone with POTS, I'm actually going to treat usually for both Lyme and for Babesia. I'm going to look for that and consider both of those, okay? So to answer your question, I think you probably need to be looking at probably treating both. If you wanted to treat for Lyme without using prescription antibiotics, but rather use herbal, which may be less problematic for the good bacteria in your gut, I would look at using herbal, the two herbal antibiotics called Otoba and Cat's Claw. I have articles about that. Let me show you that real quick. I think you may be familiar with it, Lindsay, but let me show that to you real quick, okay? Let's see here. All right, so in terms of taking a look at what to do, the herbal antibiotics called Otoba and Cat's Claw, take a look at this article here. It's where I talk about why I use them to treat Lyme, how effective they are, and how to use them, and even the science in this article, okay? All right. Thanks for that question, Lindsay. Good luck to you. Hello, Kelly. Let's say hello. Would most people test positive for some sort of mold toxicity or no? Just curious. Maybe some just don't have symptoms. So the answer is no, most people don't test positive for mold toxicity. If we look at what the science behind mold toxicity tells us, this is a whole science that was developed by Dr. Richie Shoemaker, although I think Dr. Shoemaker's ideas are a bit antiquated in terms of how you treat this disorder. His ideas behind who gets it and why it happens, I think, are very accurate. Okay, so Dr. Shoemaker is one of the physicians, or the first physician that really described mold toxicity illness. And what he was able to show is that 25% of people have a genetic programming error that makes it so that when they breathe in or eat in mold toxins, they're not able to remove them from the body. All right. That means that 75% of people can walk through a mold toxic building and never develop a problem because genetically their systems are designed to deal with it. All right. So to answer your question, if we probably tested 25% of even people without 25% of all people, if we started testing and they didn't have any symptoms, they were healthy, we would probably find 25% of people probably have mold toxins built up in them because 25% of all people have a problem removing mold toxins. All right. Now, probably you don't start getting symptoms until you hit a certain threshold, though. Okay. All right. Now, why do I say this? So, or what is mold toxin? What does that mean exactly? So, in 75% of people, what is supposed to happen is our immune systems that work correctly will see a mold toxin that gets into our blood. And part of the immune system, some cells in the immune system will tag those mold toxins. They'll identify them. Okay, they'll tag them. And once those mold toxins are tagged, other immune cells will see them and come in and break down those mold toxins. All right. And then the broken down mold toxins get moved into our poop and get moved into our urine, and we get rid of them. All right. That's what's supposed to happen. In 25% of us, and this is based upon Dr. Shoemaker's work, 25% of us, our immune systems will not tag those mold toxins. So the immune cells that are supposed to come in and break those mold toxins down never get to because they can't identify those mold toxins. All right. And then what happens is those mold toxins go to the liver because the liver is supposed to clean them out, but the liver can't. The liver is not set up to remove untagged mold toxins, all right? And so those mold toxins, which are fat-based, go to the liver. The liver's job is to take fat-based toxins and add a water-soluble chemical group to them so that they can then dissolve in water. But the liver can't do that with mold toxins. If it could, those water-soluble mold toxins move out in the intestines, mix in our poop, and we poop them out. All right. But if you happen to have mold toxins that aren't don't have a water group added to them, they go out in the intestines as a fat-soluble toxin, and they get absorbed right back into the bloodstream, and they can't get out. All right. So the way we try to get them out, if you have this problem and you have health problems from this problem, is we use binders, things that grab hold of those toxins out in the intestines so that they can't get reabsorbed again. All right. Okay. So I'm going to do a quick screen share here, everyone. All right. So if you want more information about mold toxicity illness, take a look at my section on detoxification here. And take a look at my article on mold toxin illness. And in here, I talk about testing. I talk about Richard Shoemaker. I talk about why he's out of date. I talk about urine mold testing, which is the best way to go about checking to see if you have this problem. And I talk about the various binders that you would use for this too. Okay. All right. Thanks for that question, Kelly. Good luck to you. Hello, Geraldine. Let's see. Is it important to change herbal antibiotics to avoid Lyme bacteria from becoming resistant? You know, it's an interesting question. Yes and no. And hold on, I'm going to explain what I mean by that here in a second. So, any bacteria in us can become resistant to antibiotics, especially prescription antibiotics. And so, in my practice, and when it comes to prescription antibiotics, my practice generally is to rotate prescription antibiotics about every 6 months, to change them about every 6 months. I have found herbal antibiotics, though, to be effective even a year, year and a half, 2 years. So my guide that I use in using herbal antibiotics is generally I'm going to think about changing them about every year, maybe every year and a half, or when they seem to stop working. Okay, so herbal antibiotics, there is less of a chance, I have found in my practice, that germs will learn resistance to them. There's less of a chance than germs learning resistant to prescription antibiotics. All right? Okay. Thanks for our question, Geraldine. Good luck. Hello, B. Let's see. What is the average length of treatment for Lyme, mold, and Morgellons? All right. So mold generally is going to take about 3 to 6 months to get under control in most people. Okay. In most people. Not everyone, but most people. If you're a person that's really medicine sensitive, sometimes we have to go really low and slow, and sometimes it can be a year or more to get mold toxins out. Okay. For Lyme, if you have chronic Lyme that has been in you for a year or more, an average length of treatment can be 1 to 2 years. Closer to the 2-year side, actually. All right. For Morgellons, so Morgellons is interesting because Morgellons, which we still don't know what the actual infection is that gives people the skin rashes that they get in Morgellons. Okay, so everyone, Morgellons is a condition that sometimes goes along with Lyme or conditions where people have immune suppression, because it also can occur in HIV, for instance, too. And people get a lot of sores on their skin. Sometimes they even get filaments growing out of these sores, all right? If we do cultures of those or we try to look at them under the microscope, we cannot identify what the germ actually is, but we think that there is some germ involved, all right? We tend to see it in people that have immune suppression. And so when we do testing, when I see Morgellons, I'm going to test for Lyme, and about 90 to 95% of those people that have Morgellons actually test positive for Lyme. But also it can occur in HIV as well too, okay? All right. Now, the way we treat Morgellons is to treat the Lyme. And as often as we get the Lyme under control, the Morgellons is going to get better. So often, though, what I will see is if a Lyme germ treatment's working, usually by around 6 months to 9 months into the treatment, the Morgellons, the skin rash part of this, is going to be a lot better to maybe even fully under control. Okay? That's what I see in my practice. All right? All right. Thanks for that question, B. Good luck. Hello, Kelly. Let's see. Is there any good test for mast cell activation syndrome? What would be the closest way if not? All right. So Kelly and everyone, mast cell activation syndrome involves a group of cells called mast cells. All right. So mast cells are your allergy cell. And they're the cells that when you're allergic to something, that thing lands on that mast cell. And the mast cell then reacts by releasing histamines. And histamines give you stuffy nose, give you rashes, give you asthma, may give you a lot of GI cramping symptoms. Okay, all right. Now, historically, we were taught in medical school that mast cells only did one thing and one thing only. And the only thing that activated them was allergies. And the only thing they did is make histamines, all right? But we now know, based upon science, that germs can turn them on, and stress can turn them on, and mold toxins can turn them on. And when they get turned on by stress or mold toxins or infections, they will more easily release their histamines than they might otherwise, okay? And so things that can turn them on are yeast infections, Lyme, Bartonella, Babesia, chronic parasite infections, mold toxicity, illness, okay? These are all things that can turn them on. So symptoms to start thinking about that you might have mold toxicity or mast cell activation syndrome is if you start having a lot of symptoms of histamine excess, okay? So symptoms of histamine excess can look a lot like allergic conditions. So people start getting a lot of hives, or they start developing a lot of food sensitivities to things they used to be able to tolerate. Or they start getting a lot of problems with asthma or stuffy noses, okay? Or they get a lot of GI problems, or they start having a lot of mental confusion, or they have a mess of all of those. Those are symptoms that are going to make you start thinking about mast cell activation. Now, the testing is not that good. You have the greatest chance of the test finding it if you are actually having a flare in your symptoms at the time you have the testing done, okay? But one of the tests you want to have done is a test called a tryptase. And tryptase will be elevated if you have an extreme type of mast cell disorder where you actually start developing mast cell tumors, okay? And that's called mastocytosis, all right? That's when a tryptase will be elevated. Other chemicals that can be elevated are histamine. And you can either do urine testing for histamine or you can do blood testing for histamine. And generally, those are the only two tests I'm going to do. Now, there's some other tests you can do, but those I think have the greatest chance of finding it. Now, you can still have negative testing, though. So you got to kind of go more on what your clinical hunch is as to whether it is there or not. Okay. All right. So let me do a quick screen share here real quick. All right, so take a look for mast cell activation syndrome. Look at my immune system article. I should say my immune system chapter there, excuse me. And take a look at this article called Mast Cell Activation Syndrome, where I talk about what can trigger it. I talk about the symptoms you can get. I list them all here. I talk about the testing being poor, and then I talk about what you can do, okay? In here, I also discuss what test you can do. I think I discussed the test you can do. Let's see here. Yeah, I list them here, okay? So the blood tests are tryptase, histamine, something called prostaglandin D2, and heparin. Urine testing would be prostaglandin D2, and N-methylhistamine again. I just don't find these to be that helpful. You got to tend to go what the symptom complex tells you, okay? All right. And in here, I tell you how to approach it. The big thing I want to point out is deal with stress, deal with stress, deal with stress. Stress is one of the biggest activators of your mast cells, okay? And then the other thing I like to do, if you have mast cell activation syndrome, is one of the basic things I like to do is to get people on herbs that stabilize the mast cells. The two major ones are quercetin and luteolin, and I talk about them in that article as well too. Okay? All right. Thanks for the question, Kelly. Good luck to you. Hello, Chris. Hi, Dr. Marty. My doctor has been treating me for Bartonella for almost 8 months. I have been on a variety of antibiotics and I'm not getting any better. What would you suggest at this point? Thanks, Chris in Florida. So Chris, unfortunately, there are times that treating Bartonella takes much longer than the standard 6 months, okay? Number one. Number two, there is a group of people, a very small percentage of people that even with antibiotic treatments, we're not able to get the Bartonella under control. It's a very small percentage. But at 8 months of treatment, there still is time, and there probably are combinations of things you could keep trying that might get them better, okay? And these are the situations where I usually like to try 3 prescription antibiotics for that kill a growing Bartonella. The other thing I like to do is to have people at this point on a combination of methylene blue and oregano. Both of those are treatments you can use for persister Bartonella as well as for treating biofilm Bartonella, all right? And so this is the type of situation I would talk with your doctor about and see if there is another 3 antibiotic combination they might try, and definitely make sure that you are on both at the same time of the oregano and the methylene blue. I will also let you know there is a small percentage of people with Bartonella that it takes well over 6 to 8 months. And there is even a smaller percentage of people that even with antibiotics, we just don't seem to be able to knock it out, okay? Unfortunately. So these are things I would talk with your healthcare provider about, okay? All right. Thanks for that question. Hello, Lynn. Let's see. Since you talk about a 2-year timeline post antibiotics, is how long it takes to consider oneself cured. Do you recommend that people participate in any kind of immune support or Lyme-Bart supplement protocol during this 2-year period? Okay. So what Lynn is suggesting is I've talked about we do not have a test that says somebody is cured from Lyme. Okay. And there always is the possibility that for some people, Lyme may only be in remission and may come back. But there is an opinion that some have, including myself, and I know Dr. Burrascano has talked about it before, that suggests that if you have been symptom-free from Lyme for at least 2 years and you were treated, that probably you are cured. Okay, that's what Lynn is talking about. All right. Now, what can you do? So what I like to do when I get somebody in remission is I like to support their immune system to try to help keep those germs in remission. All right. One thing that you can do is to be on mushrooms. I like using a mushroom mix called the Immune Builder 5 mushroom formula. Mushrooms, there's a sugar in mushrooms that is useful at turning on what we call cellular immunity, the cells that actually fight infection. Okay, so that's one thing I like to do. The other thing I like to do is to turn on a group of cells called natural killer cells. And to do that, I like using something called transfer factor multi-immune, which is a product made by research nutritionals. I might do 1 pill 3 times a day. And finally, a third thing that could be done is to use targeted transfer factors. Transfer factors are chemicals made by the immune system that turn it on to fight certain infections, okay? And research nutritionals makes a targeted mix that targets the immune system to fight Lyme and co-infections called transfer factor L+, and I like to put people on 1 pill 2 times a day of that, okay? All right, that's what my approach historically has been, okay? Let me show you an article where you can look at some of this too. All right. So take a look at my chapter. I think it's called Finished. Where do I do this? Oh, End of Treatment. Look at this one. Okay. Take a look at this article called Finished. And in here, I talk about steps you can take to prevent relapse. Okay. And in terms of immune system boosting, again, you can use the transfer factor multi-immune, you can use the transfer factor L+, and then you can look at using this Immune Builder 5 mushroom formula that I was just talking about, okay? Anyhow, you can find all of these supplements at my supplement store too. If you're looking for a source for anything that I recommend here, you can actually do so through my supplement store. Let me just show that to you here real quick. I keep bumping myself out of that. Let me try one more time. There we go. So this is my supplement store. This is where my patients get the supplements I recommend. And also anyone can get supplements here. All right. So the reason I maintain this is for ease of access for my patients. But the other reason I maintain this is there is it's very difficult to find high quality supplements or to know what is a high quality supplement. And so I try to take the guesswork out of it for you by maintaining this website. So if I recommend a generic herb and you're wondering which one is the best way to use that herb, take a look here. You can find it, okay? So for instance, in terms of those immune boosters that I just talked about, Take a look here, and my supplements look under the immune system. And in terms of things that I find helpful, you could look at my immune builder complex right down here, okay? And you can also look at my the transfer factor multi-immune, which is here, and you can look at transfer factor L+, which is here, okay? All right. All right. Lynn, thanks for that question. Good luck to you. Hello, Joyce. Thank you, as always, for answering our questions and being an advocate for those of us with Lyme. You're welcome. Let's see. Diagnosed in 2001, doxy for 1 month. Bitten again in 2012. Doxy caused a rash, so stopped it. Many symptoms over the years. Started serious Lyme treatments in 2016 and have improved many muscle issues since last year, including upper body, back, arms, and shoulder pain and weakness, taking everything you suggest. Started ATP 360 a few weeks ago, ramped up slowly, now up to 3 caps per day. Was taking caps separately at each meal. Is it more effective to take it at one time? Would you please explain the process behind this supplement so I can understand how it works in the body to address these problems? Thank you. Okay. So one of the things I will do for people that are not necessarily recovering easy, whether it's persistent pain, whether it's persistent fatigue, is I will look at doing repair of mitochondria. So mitochondria are the energy factories that are found in every one of our cells. And when you have chronic infection, or if you have mold toxicity illness, there is an overproduction of oxidizing agents that can damage the mitochondria. If your mitochondria get damaged, then the cells don't have enough energy to heal. And if they're not healing, it can give you fatigue, it can continue neurologic dysfunction, and it can give you pain. Okay. All right. So what I'm suggesting to you from before, and what I've mentioned in these webinars, is if you have chronic persistent pain and nothing else is working, consider doing mitochondria repair. What the ATP 360 does is your mitochondria are made up of a double layer of fat. The outer membrane is a double layer of fat. Okay. The oxidizing agents that are made in excess in Lyme damage the covering of that mitochondria. You need a healthy covering for 2 reasons. One of those 2 reasons, okay? One is that covering, when it's healthy, is useful to bring fat and sugar to the inside of the mitochondria, where that fat and sugar can be burned through a bunch of chemical reactions to create cell fuel, all right? Secondly, that mitochondria membrane, it donates electrons into the chemical reactions. And you need electrons for those chemical reactions to take place well. So if the membrane is damaged, you don't have healthy electron donation either. So you want to repair that membrane. And the ATP 360, the primary group of ingredients are a group of phospholipid fats that make up the covering. In addition, ATP 360 has a number of micronutrients in it that help the mitochondria work better, okay? And so the reason I suggested doing this is to see if you can repair your mitochondria, will it give you enough energy to start healing and get rid of that pain, all right? Have enough energy for the muscles to heal so they're not aching as much anymore, okay? All right? So I hope that gives you some useful information there. All right. Thanks for that question. Hello, Susie. Let's see, I've had years of various neurologic issues, but now the worst is debilitating facial pain. Do you have any patients with this same problem? Yes, you can. And facial pain often is probably neurologic, but also sometimes is muscle. And in a situation like this, usually what I will wind up doing, in addition to treating the germs that may be there or not there, I don't know your situation as to whether you've been adequately treated or not yet, I try to do repair work. and I try to repair the mitochondria. So what I was just talking about with the last question, that's what I would do here. One of the components is being on that product called ATP 360 by Research Nutritionals, 3 pills 1 time a day. If it is going to help, you'll probably start having some improvements by 2 months, okay? Secondly, in addition to repairing the covering of the mitochondria, you also want to repair the mitochondria from the inside, okay? And so I like having people on liposomal glutathione. And liposomal glutathione is an antioxidant made in every one of our cells that fixes things, okay? But it fixes things from the inside. And the reason I use liposomal glutathione is that glutathione microscopically wrapped in fat is better absorbed, okay? It gets into the system better, okay? And so I like using a teaspoon of that 3 times a day, 1 time a day, I should say. And the product that I use for that is a product by Research Nutritionals called Trifortify, okay? All right. Now, in addition, if you are a vegetarian, vegetarians that don't eat red meat periodically will be low in a chemical called carnitine. And carnitine is required to carry the fat across the mitochondrial membrane to the inside, okay? And for the carnitine, if you don't eat red meat, I like people to be on acetyl L-carnitine. And the product I use for that is a product by Thorne called Carnitil. And I like people to take a 500 milligram pill 1 time a day. All right. So those are all some things for you to think about. All right. So let me show you an article about how to repair mitochondria so you can read more about this and you can see the actual recommendations written down. I'm going to do a quick screen share here. All right. So you'll find information about that. Take a look at my energy and fatigue chapter for that mitochondria article. Take a look at this one right here, how to fix mitochondria and get energy in Lyme disease. I could also say how to fix mitochondria and heal ongoing chronic pain. Okay, it's part of the same equation. All right. Okay. Thanks for the question, Susie. Good luck to you. Hello, Christine. Let's see. I have a cracked tooth and an abscess. The tooth is being extracted next week. I have good dental hygiene, but I suspect the Lyme. I also have Bartonella. Got into the cracks and an infection has been brewing. Please tell me how I can prepare for the oral surgery to reduce any complications that Lyme and Bartonella causes. You know, I don't have any specific recommendations for you other than if you are on your antimicrobials for those germs, I would stay on them, okay? Beyond that, I don't have a specific recommendation for you, Christine. Good question, though, and good luck to you with that procedure. Hello, Lynn. Let's see. Is there an upper limit to how long nystatin can be taken to combat yeast? I've been on it the whole time. I've been on antibiotics about 2 years. You know, I generally do not find I have to rotate people off of that. So I use it even for years at a time without difficulty at all. And I still think it is effective over that time. Okay. Thanks for the question, Lynn. Good luck to you. Hello, Joanne. MySo just got diagnosed, or my son, I think, just got diagnosed with Bartonella after 3 months negative and only positive for Lyme. Stopped cefuroxime IV antibiotics and is now being prescribed rifampin and doxycycline. Thoughts? He has severe hyperacusis, brain fog, muscle weakness in his extremities. Thoughts? All right, so if your son does have Bartonella, and the only way I would be able to confirm that is if I could talk to you more and find out what his specific overall symptoms are, okay? But if he has Bartonella, rifampin, doxycycline is a good treatment, okay? We know from research that got published by Johns Hopkins University in April of this year and also actually the study that was published in April of this year by Ying Zhang's lab at Johns Hopkins looked at laboratory experiments to try to figure out what are the strongest antibiotics to treat growing forms of Bartonella. And in addition, what could we use to treat what are called persister forms of Bartonella, okay? So you can think of Bartonella as having rapidly growing forms and forms that go into hibernation. Okay, most of them are probably in the rapidly growing state. There's a small percentage in the hibernation state. In addition, these hibernators have the ability to cover themselves in a slime layer called a biofilm, all right? So Hopkins showed us in their experiments that the strongest antibiotics that we have to treat growing Bartonella, the two strongest, and they're about identically strong, are rifampin and azithromycin. But very close, just right behind them a smidge, is doxycycline, okay? All right. I find the best antibiotic regimens to treat Bartonella involve using two antibiotics that target the Bartonella germ that are intracellular antibiotics, and these two are good options for you, okay? All right. The only thing I would do to make this stronger is I might consider adding either methylene blue to treat the persister forms, it's a compounded prescription, or using the herbal medicine called liposomal oregano oil. The liposomal oregano oil can break up Bartonella biofilms and also can treat persister forms of Bartonella. I use that as a 75 milligram pill twice a day, okay? The hyperacusis, brain fog, and muscle weakness all could be part of Bartonella. They may also be part of Lyme. So those don't necessarily say to be specifically Bartonella. So anyhow, let me show you, do a quick screen share here for you. All right, so in terms of the things I find effective to treat Bartonella, including growing and persister forms, take a look at this infection treatment plan section here. Take a look at my article called Kills Bartonella, a Brief Guide. And in here, I lay out the various antibiotics that you can use, putting together what I call tier 1 antibiotics, okay? I give you options of what you can combine. And one of those is to use rifampin plus doxycycline plus methylene blue or oregano oil. Down here, I give you the doses that I would wind up using for those, okay? All right. And in terms of how do you diet, and in here, if you want to take a look at the research that I was telling you about, take a look at which article is it here? This one right here, number 3. This article is the one where they talked about the various strengths of the prescription antibiotics and talked about the various things that were good for persister forms of the germs as well too. Okay, all right. Yeah, that's the most recent one. Yeah. All right. In terms of how do you figure out if you have Bartonella, again, the way I generally like to do that is to rely more on the symptoms. And you could take a look at that article in my How to Diagnose section here. Take a look right here. Read through the whole symptom list to see if it kind of suggests that he might have Bartonella as well too. Okay? All right. All right, Joanne. Good luck to your son. Hello, Mia. I have bone pain and my skeletal system seems weak. Would research nutritionalist physician daily plus D3 or Mediclear's multivitamin and eliminations diet be best for my situation? You know, in terms of a multivitamin, these are things that are going to provide you the micronutrients so your system can work better, which could or could not help. I don't know if it's going to help the bone pain. It may help with general weakness. I think either one of these would be reasonable options. I think that the research nutritionalist product is a little bit easier to take as the pill form. If you're a person that is not having a lot of medicine sensitivity or sensitivities to other things, I don't think you necessarily need to do the Mediclear. The Mediclear is a very chalky substance, and so it's not the most palatable thing to take. Okay? All right. Mia, thank you for that question. Good luck to you. Hello, Mia. Again, let's see. I have a new sunlight and sauna, but I cannot sweat even at high temperatures. What can I do? So Mia, even if you're not sweating, you're going to get benefit. When you use a sauna, a sunlight and infrared sauna, or any infrared sauna, those infrared rays will heat you up. And when you heat up, that causes your blood vessels to dilate throughout the whole body, which makes it so that any herbal or prescription antibiotics you're on gets deeper into your tissues and can do a better job of killing, number one. Number two, when you heat up, that helps pull toxins out of your tissues. And about 80% of those toxins go to the liver, and the liver will process them out into the intestines where they can get pooped out, all right? So even if you're not sweating to remove the toxins, actually 80% of the detox benefit of doing an infrared sauna is not the sweat side of detoxing. It's actually sending more toxins to the liver to get them pulled out, all right? So you're still getting benefit, basically, all right? All right. There are some people that just tend not to sweat, so there isn't a way of turning the sweating on. But I just want to tell you, you're getting benefits still. Okay? All right. Good luck to you. Hello, Fiona. Let's see. What advice do you give your patients once they reach remission in order to maintain it? I answered that earlier. And in fact, I showed everyone that article. Take a look at my article called Finished, where I talk about what to do. Okay? All right. Good luck to you, Fiona. Hello, Jen. Have any of your patients achieved remission taking disulfiram at doses lower than the target dose? My target dose is 250 milligrams. I weigh 115 pounds, but I was unable to tolerate it and plan to restart with a new target of 125 milligrams for 6 months. Thanks. All right. So let me tell you what we know about disulfiram and success. Okay. And then I'm going to address your question. So my experience that I'm having reflects what Dr. Ligner is actually reporting. So Ligner, everyone, I think you may know, is one of the first physicians that started using disulfiram. And Dr. Ligner, at the annual ILADS meeting about 2 weeks ago now, it was an online event, Dr. Ligner presented on, I believe, 71 or 72 patients now that he has done disulfiram in, okay? And of those, I think it was 72 patients. Of the 72 patients, 69 he was able to follow to see what had happened with them. There were 3 that got lost to follow up. Of the 69, he reports he was able to keep about half of them on the high dose to get up to 4 to 5 milligrams per kilogram a day. The other half, he had them on lower doses, okay? What he reports to, and the reason I think he's only able to get about half of them up to the full dose is because of side effects. So just so you know, not everyone can get to the full dose of 4 to 5 milligrams per kilogram a day of dose, okay? So if you're trying to figure out how many kilograms you weigh, take your pounds that you are and divide by 2.2. That tells you how many kilograms you are. And then take that by times 4 or 5, and that gives you the dosage range that you should wind up at. Okay, so for instance, do the calculation for Jen here. Jen, let's see. 115 pounds divided by 2.2 equals 52. Times 5 milligrams per kilogram would be 261 milligrams, so 250 is fine, okay? Or if we take that times 4 milligrams per kilogram, then it would be 209 or 210 milligrams that you'd want to be at, okay? Right now, can people still have benefit if they can't hit the peak dose? Yes, they can. The trouble is, Ligner at least is reporting that he doesn't find that the people that tend to have the greatest chance of getting into remission are people that are at the peak dose, but he does say that some people, even at lower than peak, can get into remission too, okay? Of his 68 people or 69 people he was able to get, he reports that around 31 or 32%, he's seeing that he's able to get into extended remission, which means in a good place with their health for 6 months or more. Okay, about 31 or 32%, I believe, is what he's reporting with that. And that fits with what I'm seeing in my practice as well, too. Okay. He reports that about 15% of those people that he has followed developed neuropathy. That is similar to what I see in my practice. And he also reports that around 30% of people get psychiatric symptoms like depression, hallucinations, anxiety. That is similar to what I see in my practice, okay? He also reports that in his follow-up that around 45% or 48% of people, I believe, have symptoms of fatigue that worsen while they're on the treatment. That is similar to what I see in my practice as well, too, okay? All right, so those are kind of what your statistics tell you. But I will tell you, you can get well even being on less than optimal dose, all right? So I can't tell you what that percentage is. I would say it's probably going to be around 15 or 20% maybe of people that are at suboptimal dosage will get into remission. That probably fits more of what I'm seeing in my practice. Okay. All right. Did I answer your question? So yeah, I have had people get into remission at less than target dose. In fact, I've got one patient. So generally, I'm reserving disulfiram in my practice for people that have failed regular antibiotic regimens. And the reason I'm doing that is we have no evidence, even in case studies, that if we use this on people for their first Lyme treatment, they've never used antibiotics before, we don't know if it's going to work for them or not, okay? Except I've had one patient that requested, she knew that, and she said she wanted to be put on disulfiram. She had never been treated for Lyme, probably had Lyme for about 25 or 30 years, and using just disulfiram alone is what has gotten her into solid remission, okay? Through a lot of the treatment, we had to use a dose much lower than peak dose for her or than the target dose. So yes, it is possible to do that, okay? All right. Good luck to you, Jen. Thanks for that question. All right, everyone. That's it for me for tonight. It's been good being with you here. Sorry for the burp that we had in the middle where I got booted out of my browser for just a brief period of time, but I'm glad we were able to continue this. I do believe the way the recording works, it will still keep having recorded us because I hadn't officially stopped the webinar. So I should be able to show you a whole recorded version of the webinar tomorrow. At least I hope that's what's going to happen. So take a look at your email in the morning for the email from me announcing that the recording is ready, okay? In addition, in that webinar, I will have the sign up link for the next set of webinars, which will be in October. I will be taking next week off, okay? But you can, tomorrow, take a look at that, the link in your email so you can sign up for the October series, all right? The other thing, if you do like what we're doing here and you're getting benefit, please share it with others so they can get that benefit, all right? So we're a community of people with Lyme here, okay? And there are many people that would find it useful to be able to get their questions answered or to sit in and get answers here too. And I'm trying to help as many people as possible. So please spread the word about what we're doing. Tomorrow morning when the recording comes out, share that email with your friends or others that have Lyme so that they can see this information as well too. All right? Appreciate it if you do that. And good night, everyone. It's been good help being with you here tonight. And I hope that you found things helpful for you, that you got some benefit here this evening as well too. All right. Good night.